Childhood obesity has become a major epidemic in this country. 25% of children are considered overweight. Obesity can cause major healthcare concerns like sleep apnea, cardiac and digestive problems, and muscle and joint pain. So what has changed in the country to make children so overweight? Studies examining the epidemic say there are root causes to the problem. This includes decreasing physical activity while increasing sugar and carbohydrates, genetic abnormalities, and an increase of body mass index during pregnancy. The prevention of childhood obesity should be the responsibility of the parents because the main contributing factors are unhealthy lifestyle choices, genetic abnormalities, and an increase of body mass index during pregnancy. This chart here clearly shows how childhood obesity has increased over the past few years. The chart starts in 1963 and goes to 2002. Children were only included in this chart if they were in the 95th percentile for body mass index. Children, the age ranges in this chart are from 6 to 19. This chart came from the Center for Disease Control and is based on the National Health and Nutrition Examination Survey. The graph showed that children from ages 6 to 11 increased in weight by 7 to 11%, while children ages 12 to 19 increased by 5 to 11%. Most studies agree that the main contributing factor to this epidemic is a change in lifestyle. Most children have an increase of highly concentrated, sugary snacks and drinks coupled with sedentary lifestyle. If you look outside today, it's rare to see children riding bikes or playing tag anymore. Most American children's after-school activities include watching TV and playing video games. Adding to this problem is the everyday American diet. The total amount of fat consumption has decreased from 37 to 33%, but the total amount of carbohydrates has increased. Carbohydrates are made up of simple and complex sugars. This increase of sugar has contributed to childhood obesity. Adding to the problem is the availability of fast food in convenience stores. Children now have the option to snack between meals, which increases their total caloric intake. The consumption of milk has been replaced by highly concentrated sugary drinks like sodas. Today's teenager has tripled their intake of sodas. This intake of calories, this increase of sugary calories, starts a vicious cycle where the more you ingest, the more you crave. Scientists have wondered if there's more to this epidemic than a change in lifestyle. Case studies have found that 5% of Caucasian children are considered overweight, while 55% of South Sea Islanders are overweight. This begs the question, could this epidemic be related to hereditary? Studies have found 9 different genes that can be linked to obesity. The most dominant gene of these is the fat mass and obesity gene, or FTO. This gene has been shown to have a correlation with an increase of body mass index. The OB gene is expressed in adipose tissue and increases serum leptin. This increase in leptin levels increases adipose tissue and body mass index within children. In 10% of people, the gene INSIG2 was shown to have an increased risk of obesity and type 2 diabetes. While many studies have been conducted to see if there is a correlation between genetic abnormalities and childhood obesity, more studies need to be done. Newborns have increased their birth weight. Studies have been conducted to see if there is a correlation between women who have a high body mass index during pregnancy and an increase in birth weight. These studies have discovered that women do tend to have newborns that are large for gestation. The effect on the fetus is not the increase of adipose tissue, but the complex diseases associated with obesity. Pregnancy places increased demands on the body, so the signs and symptoms of these diseases are more pronounced. The largest contributor to this is gestational diabetes. The higher a female's body mass index is during pregnancy, the higher risk she has for developing gestational diabetes. The mother has an increase of sugar during pregnancy called hyperglycemia. This sugar goes to the fetus and helps to grow unwanted adipose tissue. This increases fetal birth rate and risk for diseases throughout the lifetime. 26% of children are considered overweight by the age of 2 in this country. Prevention during pregnancy is a major way to give children a healthy start in life. Based on the evidence I found while researching this complex and growing problem, there can be little debate that childhood obesity is a major healthcare concern. Scientists have done countless studies to help find the causes to this epidemic. Their conclusion has been that the main contributing factors is lifestyle changes, genetic abnormalities, and an increase of body mass index during pregnancy. Every parent has the responsibility to give their child a healthy start in life. Parents can do this by creating an action plan for their family that includes having a healthy lifestyle choices, knowing their genetic makeup, and having a normal body mass index during pregnancy. Our youth deserve the best start at life. Let's make them a priority. Does the audience members have any questions about my presentation?
Yes. Have studies found any chemical causes to childhood obesity?
Yes, that is an excellent question. Studies have found that everyday household products have chemicals in them that can change hormones in a teenager. Hormones are produced in adipose tissue, so any increase in hormones can increase adipose tissue and cause children to become obese. Are there any other questions in the audience today?
Yes. How can parents help their children make good eating choices?
That is an excellent question. The main problem that parents have is that they're too restrictive on their children's diet. They either tell children to eat all healthy fruit and vegetables, or they tell children to stay away from sugary snacks and sweets. Children then rebel and don't do what their parents ask of them. So the best way that parents can help their children succeed in life and have healthy lifestyle choices is to give them education and just small nudges in the right direction. Well, thank you all for coming and listening to my presentation about this major healthcare concern.